Okay, so this is Clinical 2 OBGYN lecture. We are starting out at the very beginning of this PowerPoint. There are 198 slides, so we're going to break this up into several little parts, but we're not going to read every single little slide. You are very capable of doing that. This is to get you through this information. So let's talk about why we do a gynecological exam and a prenatal exam. Well, this is something that is very easily done in the doctor's office or even in the hospital. And what we're doing is we're trying to make sure that we promote good health of the female. And if they're pregnant, we're trying to promote good health of the mother and the fetus during pregnancy. We have a lot of responsibilities during this exam. So as a medical assistant, we're not just there for the physician during this part. We are there for our patient as well. So we're trying to ensure that they are comfortable, they're well informed of what's going on, and that we can keep them as calm as possible. And then of course we're going to assist the physician, no doubt. No doubt. So what is the difference between gynecology and obstetrics? Gynecology is that branch of medicine that's really just dealing with the reproductive organs of women. So that's the breast and the pelvic exam. That's the part of the exam for gynecology. So why do we do this? We're trying to be proactive always and forever. So we're looking at the female reproductive system on a regular basis in order to try to catch things early if there's going to be a problem. So as the slide says, it's to detect early signs of diseases, which leads to early diagnosis and treatment. So that should make sense. Okay, so that's what we're all about doing. Now, there are several terms here that are located in your textbook, and I'm not going to go through those. You are very well capable of doing that. So make sure you look at your terms so you are, you refresh your memory from terminology, what some of this stuff is, and then also theory as well. So the breast exam. Remember, the breast exam is part of the GYN exam. We can't forget the breast. It's not just the pelvic exam. So what do we do the breast exam for? Well, we do that so we can, again, check for early signs of disease. So with this exam, the physician and the medical assistant place the patient in the supine position, and they're going to inspect the breast and nipples for swelling, dimpling, puckering, and change in skin texture. We're also looking at the nipples for any bleeding and discharge. And then, of course, the breast and the axilla, which is up in the armpits. We're looking for lumps, hard knots, and thickening. Okay? We're also going to talk with our patient about the breast self-exam. So this is something that the patient is going to do on a regular basis at home on their own. And they're going to do this in order to make sure that they're not detecting any problems in the interim between seeing us. So the American College of Obstetrics and Gynecologists recommends that women age 20 and older do a breast exam at home each month. So again, they're looking for the same things that we're looking for in the office. Good things that we want them to do is we want them to make sure they keep a good routine, a good schedule. So we'll talk more about that later on, but we definitely want them to be on a regular schedule. Good information to know is that when patients do detect little lumps, nodules, those types of things, 80% of those are benign, meaning non-cancerous, and the physician does have to make that diagnosis, but it's nice to know that a good majority of those lumps that women detect are benign. So looking at the pelvic exam, what is the purpose of that? Well, we're going to assess the size, shape, and location of all those organs and try to see if there's any presence of disease. So this is going to consist of the inspection of the external genitalia, the vagina, and the cervix. We're collecting that Pap test. The physician's always going to be doing that by manual exam, and at certain ages, and certain physicians have different preferences, but they might also include a rectal vaginal exam. For the pelvic exam, the patient is placed in the lithotomy position, so they're laying on their back on the table with their feet in stirrups, and their buttocks are scooted all the way to the end of the table. They oftentimes feel like they're going to fall off. And then their feet are put into stirrups. And those stirrups are pulled out about a foot from the edge of the table, so it's comfortable, if you can be comfortable in that position. The patient's knees should be bent and relaxed. The lithotomy position, what it does, because it is such an odd position for you to have to be in, it helps to relax that vulva and the perineum, which helps when we're inserting the vaginal speculum and doing that bimanual exam. Okay, now this is not an easy position for your patient to maintain for a long period of time, so don't put the patient in the lithotomy position until the patient is ready for that portion of the exam and the doctor is ready. We also want to remember to ensure that our patient's modesty is preserved, so we want to drape them. This is going to reduce the exposure and of course keep them warm. So we're encouraging our patient to breathe slowly, deeply, relax as much as possible, and try not to get too afraid or tighten all the muscles up down in the pelvis, because that does not help for the physician nor the patient's comfort level. Now, why do we have to stay in the room as the medical assistant? One of the first things is we have to provide legal protection for the physician, but it's also to reassure the patient and also to assist the physician during the exam by handing them instrumentation. Now, the inspection of the external genitalia, vagina, and cervix. Let's go into that. So the vulva is inspected for swelling, ulceration, and redness. The vaginal speculum, what we do is we insert that, but there's different types that we can use. There's a metal one, which is stainless steel. It has to be sanitized and sterilized after each use, and it typically needs to be kept in a warming drawer, meaning it like a heating pad with a towel over it, and that helps to keep that metal warm versus inserting that and it being very cold to the patient. Then there's also the plastic speculum, which is disposable, and that's the most popular kind that physicians use because it's one less step that our staff have to take in order to keep things going in the clinic. The speculum does come in different sizes, so it's small, medium, and large. Obviously, your brand new patient that's never ever had a pelvic exam, they're going to need that small one, but we definitely can guesstimate the size depending on their sexual activity and the amount of childbirths they've had. Okay, so what is the function of the vaginal speculum? It's not to cause discomfort. What it does is when it's inserted and activated, it holds the vagina apart so that the physician can see straight down to the cervix and make some observations, as well as insert their tools to obtain those cervical cells. This is just talking about what we've already said about storage of those speculum. Okay, so once the speculum is inserted and the physician is looking into the vagina and looking at the cervix, they're looking for the coloration of the tissue. Is there any laceration, ulceration, or tenderness noted? We're also looking for nodules, discharge, and if there is some discharge, what does it look like? Does it have an odor? And the physician typically will get a culture of that discharge. Okay, so what about the Pap test? Remember, Pap is a shorter abbreviation for Papaniculo, which is the Pap is a eponym because it's named after Dr. George Papaniculo. And what we're doing is we're looking at that cervix, trying to obtain some of those cells to detect cervical cancer. So if we do this on a regular basis, then we can hopefully detect cervical cancer early and get that treated so they don't have metastases. So the Pap test is used for, again, the early detection. The detection of cancer of the endometrium is less reliable, so they typically go with the cervix. Now, how frequently should our patient have a Pap smear? So the first Pap smear should be beginning with 3 years after having intercourse or after age 21, whichever one comes first. So when your patients are sexually active, then we're going to start those Pap smears. Or if they do not start having sexual intercourse, then if they turn 21, we would start at that point. So the direct Pap smear test is performed every year. The liquid-based Pap test is performed every 2 years. Most frequently, the physicians are going with the liquid-based because we're going to get a better idea of what those cells look like, and we'll talk about that a little bit more here in the next few slides, but the liquid-based is more reliable. Okay? Now, the American Cancer Society recommends that beginning at age 30, after 3 or more consecutive negative tests, they can go to every 2 to 3 years to have follow-up testing. But we should have a Pap test every year if the patient has a higher risk for cervical cancer, if they have HIV, a weakened immune system, or if they're on chemotherapy, organ transplantation, or steroid use. So those are the things that we would look at doing those more frequent Pap tests. So what kind of instructions does our patient need before having a Pap test? We don't want it scheduled during their menstrual period. One, because it's uncomfortable for the patient. They feel a little apprehensive about having that bleeding occurring and then having this procedure done. But the biggest thing is that the red blood cells, they do obscure that specimen, so they interfere with an accurate result. And I'll tell you that some physicians will go ahead and do that Pap smear even if the patient is on their menses, but we try to avoid it if at all possible. So we want to schedule it about 10 to 20 days after the first day of their last menstrual period. Alright, they do not need to use a douche or insert tampons, medications, or spermicides into the vagina 2 days prior to the test. And then we want them to abstain from intercourse 2 days prior from the test. So this is all in order to maintain the cells that are there in the cervix and in the vagina, if those need to be obtained in different areas, but also the medications, they can actually invalidate the test. And then of course douching and tampons